Good evening, everybody. This is again Ramesh Sabapathi on the second lecture series on hashtag coronavirus, the new normal. Today, we are going to talk about the risk the healthcare workers take every day, leaving their family behind and taking care of the sick and elderly with very little equipment, reusing masks, putting their lives in danger because they have to take care of all the sick, hospitalized patients, the nursing home residents, the frail elderly. And I just want you all to take a moment to appreciate what they do. And I'm in this profession because of such awesome people, because every day I get together with awesome people totally dedicated to their jobs, combating the anxieties about their own loved ones, but they still go out there day in and day out, changing people, taking care of them, giving them emotional support. And I want you to pause today to listen to a few people and appreciate what they do. This hits, for me personally, my son is an emergency room physician, and we all have our own anxieties regarding our loved ones doing what they do in the front lines. So I'm going to show you small video clips of people, what they do. And next time, when you come across a physician, a nurse, a technician, or a patient care attendant, or a clinician assisting other doctors, just take a minute to thank them. Because these are the people who cannot work from home, and these are the people who bury all their anxieties and their own personal problems and come in and day out to take care of America. I am absolutely sure with this kind of attitude, America is going to fight this unknown enemy and come back with a lot of positivity. And our role now is to be able to help one family who is suffering with something you can do on an everyday basis to uplift their spirits, or maybe it may be to go and deliver some groceries to them or do whatever. If each one of us can do that to the affected families one at a time, we are going to bounce right back. Thank you.
Hi, my name is Patty, and I'm a colleague of Dr. Ramesh Sabapathi. I've been a nurse for 32 years, and yes, I still love my job. The shifts are long, the work is hard, but regardless, my patient deserves to have the best care that I can give them. I try and take one day at a time and just focus on the patient and not on this coronavirus. I also have a family that I'm concerned with. I have in-laws who are elderly and in their 80s. We check on them daily by phone. We video chat with them. We've dropped off food at their doorstep so that they can stay inside and quarantine. And that is the best thing that you can do for the community, is to follow the CDC guidelines and our governor and stay indoors. Lastly, I'd like to say that we have no control over what is going to happen, and all the anxiety and the stress and the worrying that we're doing, we're just putting that burden on ourselves, and it's not making the best out of the situation. We need to right now reflect on the positive things that we have in our life and to continue to pray and let our faith get us through this time.
Hi, I'm a friend of Ramesh Sabapathi's and a nurse in a hospital. I willingly go to work every day because I became a nurse to help people in their time of need. Even though there's a possibility that I could be infected with this virus, I chose this career and I do whatever possible to keep people safe. I deal with the anxiety of possibly infecting my loved ones by knowing the hospital I work in does everything possible to keep its staff safe. So, in these trying times, if you see a healthcare worker, thank them for what they do. It would be greatly appreciated.
Good day. My name is Alkesh Patel. I'm a colleague and friend of Dr. Ramesh Sabapathi. I practice family medicine in Maryland. And during these times when there's a lot of anxiety and things around COVID-19, I continue to come to work. In fact, I'm glad that, considered an essential service on the front lines in healthcare, to being able to screen patients as well as take care of my regular patients who need routine medications and care, but also those who have questions and concerns about symptoms they may be having that could be related to COVID-19. I also have parents that I take care of or that are home, so I have to be careful, practice great hygiene, and get adequate rest. So I implore everyone to follow the recommendations of your local authorities. In Maryland, I know now we have a shutdown of non-essential businesses to prevent the spread of the virus.